Okay, guys, watch me carry out this procedure. Which procedure is this? This is family planning method. I've already explained all the type of family planning methods to my patient, and she chose Implanon. What is Implanon? Implanon is a type of family planning method that is grouped under implants. It is hormonal and it lasts for 3 years in my patient's body. So before you carry out this procedure, you first of all check if your patient is menstruating. If she's not menstruating, you carry out pregnancy test on her. She's not menstruating, so I've carried out pregnancy test on her. Again, we gain the husband's consent. Okay, before you do any family planning method, your husband consent is very, very important. So we've gained the consent of the husband because she's not a widow. So this is the materials I'll be using. This is a sterile environment. I'll be using this paper to cover the bed so that it will not be stained. This is local anesthesia, that is lidocaine. Okay, with my 2 ml syringe, my sterile gauze, this is alcohol swab, and this is my receiver. So Nne, are you ready for this procedure? She just gave birth. Her baby is 3 months old. Okay, I do advise my patients, whenever you want to do family planning and you are still a breastfeeding mother, you should wait for at least 6 weeks, a month and 2 weeks, so that by then breast milk production must have been properly initiated. So that is it. Watch me carry out this procedure. Let me raise your hand for me. Okay, make sure you swab the area with the alcohol swab. You can use any antiseptic that is good, any good antiseptic to swab the area to ensure that the area is properly swabbed to avoid introduction of microorganisms into the patient's body while injecting Implanon. Okay, okay. So yes, I'm going to target the place I'll be putting the Implanon. Okay, okay. See how I just positioned her hand. So I'll be injecting my Implanon from this axis to this axis. Okay, you can use pen and mark yours so that you will not miss the points. So I will inject local anesthesia to her. The essence is to minimize pain. Okay, is to minimize pain because this thing is needle, very big needle, very large one. Okay, you can't just inject it into someone's body without sedating the person, without knocking off that particular side. So I'm injecting her lidocaine to knock off the area where I will be inserting the needle. Okay, so this is how. Are you feeling any pain? So I use this needle to check if she's feeling any pain. In my local anesthesia. This is okay. Okay. So this is Implanon. First of all, before you inject, you first of all check the date and make sure that the date, it is still up to date. Do not inject the one the date has been updated. Okay. Can you see it? So this material now, if you open it here, you will find the family planning stick, the implanol stick. It has only but one stick. You will find it inside the needle here. Okay, you look at the needle, at the opening of the needle, you will see something whitish inside. That will show you that this injection is loaded with the stick. It is loaded with it. So but if you look inside it and you not see the white stick, it shows that maybe there is company fault. You change it and get another one for your patient. So my own is loaded. Now you ready? You are ready. Okay. You push the plunger back. Good. Guys, can you see? Okay. You ask your patient to touch it. Get touch it. Can you feel it? Okay. That's your family planning method. Okay. I'll be covering the place with my sterile gauze. Okay. Okay, guys. This method now, after carrying out this method on your patient, you allow the patient to rest for some minutes. Then you watch for signs of dizziness. You watch for any reaction on the patient. Make sure that the patient is not reacting to it. There is no dizziness. Are you feeling dizzy? Hmm? Are you feeling dizzy? Allow your patient to rest for a while. Okay? 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 The essence of covering it up is to stop bleeding. Okay? It's just to stop bleeding. So, guys, I will watch my patient for some minutes and ensure that she is not feeling dizzy. There is no reactions in her body. See this label that came with Implanol. Okay, these are stickers. You will use one of the stickers, write the patient's name, date of insertion, expiring date, then ward number. Depending on how your facility operates, you give it to the patient. When you give it to them, when they get home, you will ask your patient to stick this sticker at the door or at her bathroom or anywhere that she can always remember when to come and remove the family planning method. You advise your patients on the post implanol insertion, which are you are not going to meet with your husband for the next 3 to 5 days. For the next 5 days, okay? Even if you have to meet your husband, you have to use barrier method. You use other method of family planning method, okay? The reason is for this, the hormones that are impregnated inside this stick. The reason is for it to your body to adjust to it, okay? For all of them to circulate into your body. Because if you meet your husband before the hormones circulate into your body, you are likely to get pregnant. So if you must meet your husband, you use barrier method like condom or chemical method, or you can use emergency pills to protect yourself. Okay? Thank you. So guys, thank you for watching my video. If you find my video interesting, please share.